Thank you very, very much, Dr. Scriver, for that wonderful presentation, and your own personal perspective on your career was wonderful and a treat for us. At this time, we have another treat, and it's certainly been a highlight for me of 2009, and that was to finally get the opportunity last year to meet Dr. Koch for the first time in San Diego at an international conference. And Dr. Koch would like to share with us tonight a case study of his first PKU patient that he ever treated, and tell us for a few minutes about that and what this gentleman is doing tonight. So it is with great pleasure that I am going to now bring Dr. Koch to talk about that, which really started, for him, an incredible career that has really benefited us all.
When Christine called me and told me I would follow Dr. From Canada, whose name I can't remember, I told her that, if I'm going to follow him, I'm not sure there's anything really that I can present that would be useful. And she said, well, that's all right. You won't have to talk. You can just accept your award. So I thought about that, and then I called her back and I said, I've been trying to think about something interesting that I might be able to present. And it was a little bit of thinking on my part. And it occurred to me that so many young people are the result of newborn screening and are in treatment from various clinics all over the country. And they probably are getting a different story from each one. And the reason I say that is that there is a physician named Dr. Bessman who made the proposition that the diet was all BS. And he thought that it was a tyrosine deficiency that was really causing the major problem. Well, I knew that was wrong because I had been treating PKU patients for several years, and I had never paid much attention to tyrosine. And to be honest with you, even today, I don't pay too much attention with tyrosine because I've never cured any PKU patient with tyrosine. And so it was very interesting to battle with Dr. Bessman because he was a professor of pharmacology at the University of Southern California, where I was. And of course, we didn't speak to each other because we didn't like each other. But he was very positive in his opinion. So I want to present to you the first case that I had, and if we could just show that first slide. Roy is a man who today is an adult who is 54 years old, and he obviously was born before newborn screening, and he was so lucky that his mother was a nurse. And when he was born, he looked perfectly normal to her, and she was very happy. But at 6 months of age, he wasn't rolling over yet, and it didn't seem very sparky to her. And that was quite an unusual term. I'd never heard that before about children, and I never thought of our kids as being sparky. But anyway, the thought occurred to me, I'd better see this child. And so I told her that she was under good care with her pediatrician in a small town in the Central Valley, and when it was convenient, why, I'd be happy to see him. Well, she waited 3 more months till he was 9 months old, and she got up one Sunday morning and read the Sunday paper. And in the Sunday paper was an article by Dr. from a neighboring institution that is well known and had a PKU program at that time. And the director was Dr. Sandoval, and he was a person who had trained at Children's Hospital, and so I knew him. And then I got a call from Dr. Sandoval. He got a 5-year extension to go to India, and he asked me if I would take his PKU patients. Well, I hadn't had any PKU patients except the one that was on the line that was coming down to see me. And when I saw that patient, I said, well, he's obviously retarded. He was a year old by the time I saw him. He didn't roll over. He didn't babble or cry. He just lay there, and he was a little fat. And I thought, well, gee, maybe he's got hypothyroidism. That came back normal. And obviously we did the PKU level on him, and that came back positive. Well, it just happened that at that time, of course, we were into the diet, and so we started him on the diet at that time. And what could you tell his mother? This child was already a year old, and he obviously was mentally retarded. He had a developmental quotient of 46, which is pretty low for a 1-year-old. And so I tried to be as upbeat as I could with her, and told the mother and father that we would treat the patient, and they wanted to know how well he would do. And of course, hell, I didn't know. So I lied and I said, you know, as a physician, you're allowed to lie once in a while. I said, oh, he's going to improve. Well, he did improve. And today he has an IQ of 96. He's married, has 1 child. That's normal. He has 2 jobs, not just 1, making me look lazy. And next slide, he just is a nice person. And he's married and has stayed married for all these years. And so he makes me feel somewhat victorious over Dr. Pestman. And I know I shouldn't take the name of someone who's near his deathbed in vain, but he left such a mark on me that I can't help it. So that was the story that I wanted to tell you. Now I want to tell you that one other little thing. Behind every man there are usually 1 or 2 or 3 women. And it depends on how much you get around, of course. And I do want my wife to come up so I can introduce her. And then I have one other lady that obviously has been important in my life, and she was the mother of one of the first infants admitted to the long-term study that we did on babies to show that if you stayed on the diet, it was more useful and better and more imaginative in terms of IQ development than patients who came off the diet at age 6. Now, it's difficult for an audience like this to believe, but there were many physicians who did not believe in the diet in the early days. And for example, in Poland, there was a study done where diet was discontinued at age 2. And for 2 years they were off the diet, and when they obviously were mentally retarded after being off the diet for 2 years, they were 4 years old, they decided that they ought to stop the study. And it's really fascinating that somehow that rubbed off in the States. And we discontinued the diet in 78 clinics in the United States from about 1974, when it was published by Horner in the New England Journal, which is the best journal that we think of, and they don't make many mistakes, but that was a terrible mistake. They discontinued the diet at age 6. And so there was a real feeling that the diet was difficult, the product that was being fed was awful, and the parents were having a terrible time with it, and so on and so forth. And we got to get these people off this diet. And for 10 years, people were discontinuing the diet at age 6. Well, we started another study to show that you needed to continue the diet. And I'm happy to say that the nutritionist who was the first mother in one of that study is Catherine Mosley, and I'd like her to come up. So, there's just one other story I'd like to tell, and then I'll let it go. But, you know, it's hard for me to stop. There is a young lady in the audience who comes from Australia, and she was the first PKU patient treated in Australia by her mother. And the doctors didn't know what to do with her down there at that time because they hadn't had any experience with it. And Debbie, I'd like you to come up and join us. And Debbie's only problem is that she is a dear first survivor, and of course has had to lead the way. And I'm really quite proud that she's done what she has in Australia, and she's still active. And I won't tell you her age because that's not quite appropriate. But these three gals have just done a lot for PKU, and I think they deserve to know it. Thank you.